And so that's going to improve mental performance, which I think is fundamentally important to this whole process for these executives. And just take us from the difference between females and males, because I'd like to sort of set a frame of where you start. I mean, obviously, one of the biggest areas is people come in, what food they put in, ultra processed foods in their mouth. And we want to, change as much as we can that's going to move the needle the most, or should I rather say, what are the biggest things and a framework that someone's listening and saying, geez, I've got brain fog. I've got a bit of a dodgy stomach now and then, and I can't just eat what I want to, and I bloat a bit, and I've got a bit of discomfort. But I'm really concerned about just levels of anxiety, levels of depression. I mean, these are exponentially increasing worldwide, especially here in South Africa. It's never I've seen in 25 years of practice, people struggle with their mental health and performance. We even do a cognoscopy, which is an online test by Dr. Dale Bredesen, and having a look happening to the brain. So take us through your framework that someone's listening saying, okay, I haven't even looked at my gut with regards to mental performance.
Right. Well, I'll just quickly, by the way, really love everything that you said. And remember that the limbic system also is in charge of fear and anxiety and conversion of short-term to long-term memory. So there's a lot of cognitive implications associated to the limbic system, and that does tie back to the gut. So, the first appraisal you could take, like you were saying, a dodgy stomach, maybe I notice I skew more toward loose bowels, and that's, a few or several times per week I have a bout of loose bowels, or maybe I'm more constipative, or maybe I had this reflux and this prolonged fullness. These are all little flags that something's awry in the gut, and that could be impacting the brain. So then what do we do about it? Well, I'm assuming that your audience is probably educated enough and proactive enough to where ultra processed foods are not an issue. They're probably exercising. They're probably paying attention to sleep, not drinking alcohol to excess, right? All those fundamentals. So I'm going to assume that layer has been addressed, and then go to the person doing those things as best one reasonably can do. Then the framework, I've been looking at sort of these various gut types, because it helps us select the best diet. Coming back to my earlier point that it's not all about keto or about plant-based. I think they all have a time and a place, but it's how do we pair the dietary intervention with the individual? And so there's clues that we can look for. The bacterial type gut. So let me take a step back. There's three types. There's bacterial, fungal, and immune. The bacterial type guts, they tend to be the ones that have too much bacteria, and they flare when they consume foods that feed bacteria. And these are foods that we often say are healthy, like broccoli, asparagus, cauliflower. These are the high FODMAP, high or high prebiotic foods. So prebiotics feed the bacteria, the probiotics. And what's interesting about this is someone might come into the clinic and say, the better I eat, the worse I feel. I load up on vegetables and fruits and I feel bloated. And then after I feel bloated, I feel kind of foggy and tired. Well, again, it's not good or bad in absolution. It's if your system, if your stomach, if your intestinal tract already has too much bacteria, and now you're eating a diet that's really pro-bacterial, you're flaring the problem. So these people do really well on a low FODMAP diet. And by the way, there's numerous clinical trials demonstrating efficacy for symptoms, most typically as IBS, so gas, bloating, abdominal pain, constipation, diarrhea, but also a number of trials showing reductions in leaky gut. And this tends to generally correlate with cognition. It's not an absolute rule, but if we can assume that the degree of gastrointestinal symptoms generally correlates with cognitive function, again, not an absolute rule, but if we can improve the gut symptoms, we generally tend to see an improvement in the brain symptoms. So I'll pause there, but that's the first gut type.
Yeah, and I think this is important because I just listened to you a lot, and you've always said, okay, if you're going to do this and say you're going to change your diet and you're going to take a lot of prebiotic fiber and you're going to have a lot of these, vegetables and fruit and these, feed the bacteria, and you don't feel good, you give it 3-4 days, 5 days, and then you see the response in terms of what happens. If it continues those symptoms, then possibly it's not something, and changing one variable at a time, it's not for you, and you might need to change that approach. But what happens from a data-centric model? We run a very data-centric model with heart rate variability. Do you have any science or sort of any experience of someone starts like a food because they got issues, and all of a sudden, yeah, they're not sure. And was it now the alcohol? Was it actually they started eating more asparagus, and now they possibly eating some lectins, or they eating some oxalates, and it gets complicated. But from a data centric point of view, is there any way to quickly assess after 5 days to say, hang on, I've got to persist with this, or I've actually got to stop based on the first bacterial gut?
Yeah, this is a great question. It's really a clinical question in terms of how do we assess if we're on the right track? Um, Usually you're going to see clear response by week 1 or 2. Now, the challenge can be that people tend to have variability in their baseline, meaning very few people feel the same day over day over day, but there's, a little bit of ups and downs. And so what you're looking for is assessing the slope of that line. Is the slope going upward? Are the better days a little bit better? Are the down days not quite so bad? And so that's what tells you if you're on the right track. So 3 days might be a little bit early, right? But by the time you're at the end of week 2, you should be able to do a look back and say, you know what? Generally speaking, I'm better now than I was 2 weeks ago. And if that's the case, you want to continue. Sometimes you'll have a very clear answer, meaning, let's say you are a bacterial type and you go on like a low carb, high vegetable paleo diet. You may notice within 2 days, like, holy smokes, I'm bloated. My bowels were very loose, right? So, okay, the negative reactions tend to manifest a little bit more quickly than do the improvements. So, I guess do with that what one will, but give yourself, I would say, at least 2 weeks. That should tell you, am I on the right track? Or if you have a pretty notable negative reaction, that tells you we're on the wrong track, and then go to a different one.